tough. Well, for those who don't know me, I'm Dr. Aneeq, and you are watching Health Dose by Dr. Aneeq again. Anyways, coming back to the point, and I was going to explain you today that how are we actually going to solve clinical-based MCQs, as these questions are the most dangerous and the most confusing after I think they come on the top, right on the top. So uh, these are not that difficult, but you have to create a mindset of a clinical pharmacist in order to tackle these questions properly. And stay with me till the end, as I'm going to give you 10 best tips in order to crack these clinical based MCQs. And one tip is going to be the best, which is going to be at the end for you guys. So please don't forget to subscribe and make sure that you are getting all the notifications, because these will help you guys a lot. So let's start the video. As you can see, there is a clinical scenario over here. I have written it, and it is the most, as you can say, the close by thing that I can get in the textbook, and for me, it is going to explain you a lot of things. But as you turn yourself and give yourself to the clinical point of views, let me tell you one thing. As I have written 1, 2, and 3 over here, this means something. I will let you know. And the first thing is the answers. The most important thing is the answers, they as one of these is going to be the right one. So finding the right one is going to be a huge problem. So how can you do this? How can you segregate this question into parts, and within 90 seconds, how can you find out which is the right answer? In order to do so, you have to divide the question into 3 parts. The first part is going to be the answers, the multiple choice answers. You're going to read them twice if you have to, and then you have to find the question. Read the question twice, not once, twice. As it says to, the second step is going to be reading the question and understanding how it is going to happen. So the question says, which toxin, otherwise breathing on its own, okay? The question says, which toxin do you think is producing such severe effects in this child? We will read it twice. Yes, person. Which toxin do you think is producing such severe effects in this child? So as you can see and read and listen and understand, in order to find the right answer, okay? So let's read it and read it fast. A 3-year-old boy is brought to the emergency department by his mother, who reports that he has been crying, underline this one, crying continuously and does not want to play or eat for last few days. She also states that he has not had regular bowel movements with mostly constipation and occasional diarrhea. Underline these important words, and frequently complains about abdominal pain. The child now has a moderate level of consciousness, is difficult to arouse, and begins to seize. The clinician now, this is important, okay? The clinician rules out infection and other medical causes upon questioning. Upon questioning, the mother states that house is in an older neighborhood house has not been remodeled or repainted since 1940s and paint is sticking around windows and doors. Child is otherwise breathing on his own and urinating normally. Which toxin? So the second part starts with. So a clinical minded pharmacist usually finds these things very important, such as old neighborhood, uh, things like that. What did the clinician said actually, not regular movements and constipation is also there, including diarrhea as well, has been crying continuously. So these things are very important. So what I did is divide the questions into three parts and like the numbers, we have to follow these steps. Read this first, read the second, and read this third. So now we will start with the 10 most important things that you can apply on any clinical scenario, and it will help you a lot. Number one is master the SOAP format. Okay, so what is SOAP? SOAP means first you have to see what the patient is saying. Okay, what he's saying, note that down. Okay, O means what you see, what the images or the clinical laboratory reports say. You have to find those things. And for A means what's the diagnosis, what is going to be the problem, and what are you going to diagnose. And D and P means what you should not do. Okay, so this is SOAP format, and I told you before that you have to find the question first, and you have to understand it. Okay, the question and its understanding means if you've done it properly, it means 50% of the question is almost solved. Okay, number three is use the rule of three. Number one is what is the diagnosis? Number two is what is the urgency? For example, if a patient is unconscious at the point, and what is the first thing that you have to do in order to make sure that the patient's safety is not being compromised? Number three is what you have to do on the basis of evidence. Means that what did the evidence say, what did the practices say, in order to making sure that the patient survives and the patient survives in the best possible way. Number four is elimination method. You have to go through the answers one by one and find out which answer is the most wrong, which is the confusing one, and which is actually close by but not according to the guideline, and which answer is being supported by the guideline, the evidence, the study, the research. So you have to find out that answer which is being supported by prior mentioned things. Number five is find out next best step logic. Prioritize next best step logic. Okay. Number six is don't jump to the treatment without diagnosis. Don't jump to the treatment without diagnosis. That's number six. Okay. Keep following, and make sure you subscribe the channel if you haven't. We will meet again, and I will share other things which are very important as a student and as a professional who are going through a lot of things, a lot of tests, a lot of study. So this will help you out during your journey. I wish you good luck. Keep following, and make sure you hit that subscribe button. Number seven is recognize the triggers and buzzwords. Okay, so painless hematuria in smoking, it means that bladder cancer. Okay, so making sure that painless hematuria in a smoker, what does that mean? It tells you that it is a cancer, a bladder cancer. So find out words like this. So these will help you in putting the triggers and buzzwords in your head and finding the right answer. Number 8 is stay updated with the guidelines. You have to study hard, making sure you follow the latest textbooks that are available in the market and available online so that you are up to date with your knowledge and with the clinical practice in order to making sure that you don't get hit by any kind of clinical based MCQ again. Okay. Number 9 is practice with explanation based MCQs. Explanation based MCQs, they actually help you with everything that is going to be problem in the examination. So these explanations will actually guide you, and maybe one of the explanation which you have in your mind, it will help you to solve that one MCQ which is going to change everything. And this MCQ is literally going to change everything, because I've seen people who are just passing the exam on basis of only single correct answer. So make sure never to skip anything. Study hard and study everything that is there, making sure that you will pass the test and you will get through this. Management 90-second rule. Every MCQ get 90 seconds only, and if you are anywhere unsure that these 90 seconds are not enough for a question, or you are stuck on it, please skip it, mark it or flag it, and come back to it after you are done with your test. And I'm sure that most of the time when people are done with the exam, they are done with the pressure, so they have the ability with a fresh mindset that they can build a clinical reasoning journal. Whatever you learn, write in it. Because when we use our three senses at the same time, it is mostly highly likely that our memory is being transferred to a more, it becomes a permanent memory. Okay, so I hope you like this video, and if you do, please hit the like button and make sure to subscribe this channel, as I'm new to YouTube and I've started to get myself out there, and it's not easy to make the content again and again. But since I have this urge to help the students and making sure that they pass their DHA exam, and if you are looking for one-on-one coaching sessions, you can contact me, and we will get you through this test and through all the preparation. Everything is science backed and everything is research based. With Dr. Aneeq, trust me, I'm a pharmacist. All right, guys, take care. Until next time. Bye.